Okay, good morning, everyone, to the Wednesday, December 1st media briefing with the Windsor-Essex County Health Unit. We'll have a few remarks from our CEO, Nicole Dupree, and then we'll go right into questions. So, Nicole, after you.
Good morning, everyone. Thank you for joining us. So I'll just cover, today we're reporting 89 new cases. 37 of those are close contacts of a confirmed case. 15 are community acquired and 2 are travel related, and 34 cases are still being investigated. Currently in Windsor-Essex, we have 571 cases that are active and 28 active outbreaks in Windsor-Essex, 8 of which are school-related outbreaks. Our vaccinations continue. Our plan continues to roll out. And currently for our 5 to 11-year-olds, we're happy to report that we have vaccinated 4,231 first doses have been administered to our 5 to 11 age group. So we're at about 12.8% for this age group at the moment. And that's it. Just a few rundown of the numbers and happy to take questions.
Okay, thank you, Nicole. We'll start with CTV today.
Good morning. Southwestern Public Health announced new capacity limits in some areas to curb case counts. Is this something that you're considering for this region as the cases continue to increase?
Well, every option remains available to try to contain COVID-19. I think the first thing to think about is that we have to think of what is how do we evaluate the burden of disease? The burden of disease is in part related to the number of cases, but it's also the number of people currently admitted to the hospital, the number of people in the intensive care unit, and the number of young people that have been excluded from school, the number of outbreaks in the community. So we have to put all of that data together to try to make a judgment. The other issue is that we wanted that reducing the number of people who congregate is clearly a strategy to reduce the transmission of COVID-19. With or without any public health direction, I would ask every person who's contemplating having a party to think about, do they really need to have the party? And if they do, how many people really have to be there? And are the people who are coming to the party vaccinated? You know, we have had in Windsor-Essex exposures in schools that lead to exposures at recreational events like pickup hockey, which then ultimately lead to an exposure at a party. And I think we all have a part to play in trying to contain COVID-19. So in short, sorry for the long-winded answer, but I think that the focus is that every option remains available in the health district. The health district has promulgated Section 22 orders in the past, and they remain available depending on what the data might lead us to.
Thank you. And is it especially challenging in this region because of the reopening of the border? And if there were capacity limits here, people could technically just cross over to Detroit, where there wouldn't be the same limits.
Well, as a general construct, border areas where there's more traffic, there's more risk. And as a general construct, the more human-to-human interaction, the more likely that respiratory diseases are transmitted. So being at the border zone has a particular additional risk. But one thing to think about is also that we have to recognize the culture of our community. We live in Windsor-Essex is a border zone. People have family on both sides of the border. We're sensitive to that at the Public Health Service, that we want to obviously contain COVID-19, but we also want people and families to have as normal family life as possible. So in formulating public policy, we consider that as we move forward.
Okay, thank you.
Any questions from CBC?
Yes, please. Good morning. How concerned are you that people being asked to isolate, either being exposed to COVID or have a close contact, how concerned are you that individuals are not taking public health advice and not isolating when they should?
So Nicole, maybe you could
Yeah.
speak to that, and I'll just share my perspective.
Sure, I'll start. Certainly, we're concerned, especially as we see our community rates of COVID increasing. So the risk in our community is greater. One of our key messages is if you've been directed by public health to isolate, you need to isolate, and that includes all activities. We are concerned that we are seeing and hearing maybe not as strict adherence to some of those public health recommendations, including isolation. And I think we certainly at the Public Health Unit can appreciate the confusion. There is a lot of varying guidance depending on different situations and scenarios, and it can be confusing for individuals depending on where they're looking for their messaging. But ultimately, that guidance is given directly by the public health. Isolation requirements are directed by our public health unit to individuals, and that's the direction that folks should be following. If there's questions or concerns, we remain available. We remain available 7 days a week, and individuals can call us for clarification if they're unsure. But it is definitely important for people to adhere to the guidance of public health if we all sort of want to keep going and maintain our maintain our community where it's at. I don't think any of us want to see rates as high as we had last year around the holidays.
So if I could supplement that, I know sometimes the message is repetitive, and but about 500 people, and Nicole, correct me on the numbers, but about 500 people in Windsor-Essex died of COVID-19.
Close to 471.
Yeah. So 471 people have already died. We're seeing an uptick in cases, and the public health measures, and self-isolation is an important one, are effective strategies to contain COVID once one is exposed, to make sure that they don't infect other people. If you've been advised, and if a person has been advised to self-isolate, they should self-isolate, which means they stay at home. And we are concerned that on occasion that individuals who've been told to self-isolate appear not to be following that direction. There are a whole group of sanctions that non-adherent individuals could be subject to. But really, what we want people to do is what is their civic responsibility, which is if you've been advised to stay at home, stay at home. If you've been advised to get a test, get a test. And we would appeal, and I think the Public Health Service would appeal to all residents to follow public health advice. The second is something that is not always well articulated. What we're trying to do is to break the chain of transmission. So we're trying to break the chain of transmission from a young person to their mom or dad, and from their mom or dad to their grandfather or grandmother, and from their grandfather or grandmother who might visit a nursing home or interact with another elderly person or a person who's sick from getting COVID, who then ultimately might get sick and die. So the inconvenience that the person who's self-isolating experiences is significant. They have to stay at home for a period of time. But the consequence of them not self-isolating can mean the transmission of disease, and it could lead to the chain of transmission where somebody dies. And so, to the extent that we want to share that this is an important goal to self-isolate, we would ask people to follow public health guidance on matters of this nature.
Thank you very much to you both.
Any questions from the Windsor Star?
Yes, good morning to you both. I know resources are stretched thin, so are there still measures in place to follow up with individuals to ensure that they are self-isolating after they've been told to do so?
Yeah, so thanks for the question, Taylor. I'll start, and Dr. Nasseri can add. It is definitely a balancing act for us, as it relates to all of the priorities that we have. We've said that before, and certainly when our cases start to rise, it does put pressure on our resources. We work with our local police as well, and appreciate all our enforcement partners. But we do follow up with people. Monitoring is part of our the case and contact management practice. So our team will continually reach people, and if we can't, there are additional measures that we will take if need be. It does require a lot of resource for us if individuals we're not able to reach them and we're not able to find them, meaning they may or may not be following our direction to isolate. It is a lot more resource on our end to follow up, but we do still have those resources in place. I think depending, if individuals were to ignore public health advice completely, and I'm not sure, we'd have to assess our capacity to follow up with everyone in that regard.
So if I could just follow up, at the current time, we have the ability to do case and contact management. Stated another way, at the current time, we have the resources in Windsor-Essex to effectuate containment of COVID-19, which is what case and contact management is. If there's an exposure, then that person is self-isolated. We identify their close contacts, give them public health guidance and advice. And we can manage with the current burden of disease. If we had 5 times as many cases, I fear that we would saturate our resources. So we're always monitoring to see, is the resource envelope for the health district sufficient to manage containment? The second issue is a broader issue, which is that there are other public health priorities beyond COVID. And when we have to and we're trying our best to manage all those other priorities as well. And when the public health services resources are focused disproportionately on one problem, other challenges are not well addressed. So I would share with you that there are 2,500 people who died of opioid overdose or opioid use last year, about that number. And we want to work on that issue as well. I would hope that our media messaging would also say that get an naloxone kit, especially before the holidays. If you have any feeling that there might be someone in your household at risk, get a naloxone kit. So we think that, I know I'm speaking boldly on this, as much as case and contact management is important, and it is, we also are concerned that other public health measures or other public health priorities are being crowded out. And that's one more reason to try to keep our case counts down.
The 2,500 opioid-related deaths, Doctor, was that a provincial statistic?
It is. We can give you the exact number. It's on the provincial website. If you send us an email, we can give you the exact number and for the time period. But it's clear that more people are dying of opioid overdoses than motor vehicle crashes. And again, I'll give you the exact numbers if you send us an email. But I think for it's 4, 5, or 6 times. I think the number of car crash deaths in Ontario is about 600. The number of opioid deaths in this province is about 2,500. So that's the magnitude of the burden of opioid-related deaths in this province.
Thank you for that. And separately, I wanted to talk about outbreaks. I saw that yesterday on the Health Unit's website, you've now included information pertaining to the number of cases linked to each outbreak, which is very illuminating, eye-opening to see that, considering that previously we'd only seen it for long-term care and retirement homes. So can you comment on the strain that the outbreaks put on Health Unit resources and what it takes to deal with them, considering how many we have right now? It's a very high number, and also how many cases are linked to them.
So Nicole, maybe you could comment on the resource issues.
Yeah, I think it was articulated a little bit earlier, just when we talked about case and contact management, but to manage the number of outbreaks and growing that we have, it requires additional resource and attention. And there's split resources. So our public health inspectors, who are a main part of our outbreak management and outbreak response, have that team manages many other things that are ongoing and public health issues in our community. so it definitely puts a resource strain on us to manage and monitor, the number of outbreaks. As Dr. Nozathuri said, our goal is to determine, and break the chain of transmission, whether it's at a workplace, a congregate setting, or a long-term care home, and to work with the facility to assess and help them manage. So yeah, it definitely puts a resource strain. I'll just comment on the change in our reporting. So I know I had mentioned a few weeks ago, we are looking at how we report our outbreaks on our website. So going forward, you'll see probably a few more changes, but this is just one on a go forward basis where, we will be reporting, the setting as well as the total number. And certainly it helps to give maybe the community and others an idea of what, the public health unit is managing, and hopefully reinforces some of the messages that we have been saying over and over for the past year and a half in regards to adherence to public health measures.
Yeah, at a granular level, and again, we can give you a better estimate, but if you have 30 people associated with an outbreak, that means 30 interviews that need to be done. Those interviews can be an hour and a half. Then if there are close contacts identified of those cases, and that can be 3, 4, 5 for each case, that's probably another 30 minutes, 45 minutes, an hour of phone calls. Then it's all the documentation, putting it into the computer system and abstracting the data. And then on a periodic basis, all the people who are cases and all the close contacts require some level of monitoring. So one outbreak with 30 people can ultimately lead to hundreds of hours of staff time. If it's $40 an hour for staff time, and we have 400 or 500 hours of time for an outbreak, we can do the math. It's $15,000, $16,000, $17,000. We can give you projections, but outbreaks not only saturate public health resources, they take skilled people who can do other public health activities, but also it's very resource rich. And that's one more reason we want to try to contain outbreaks and the number of outbreaks as much as possible.
Finally, on the topic of outbreaks, can you discuss maybe anecdotally the kinds of lapses in infection and prevention and control measures that you're seeing that are causing or allowing these outbreaks to happen?
Yeah, without identifying anyone or talking about any specific event, one is that I'm very concerned that people aren't verifying the vaccination status when they should be. Secondly, I think I'm worried. I am very. I think the Public Health Service is concerned that people who are sick are actually making their way to some of these recreational and social events, and so they're not self-screening. If you're sick, stay at home. I'm concerned that people are not always forthright with who their close contacts are. But my biggest concern is that we're having we're seeing clusters in the community of people having social and recreational events, and I understand that, but I also think that those create a high-risk situation, especially if people aren't wearing masks, which is one more additional struggle that we experience. And it's only human to want to interact with other people. But I think those are some of the challenges that we face moving forward. Thinking of burden of disease, we have more cases now. The last time we had this many cases was in early September. So, and we're going into a season where there'll be more human-to-human interaction because people will want to get together with their families and friends. There'll be more travel. So we are very concerned that we're going to see increasing number of cases over these next few weeks. And Windsor-Essex has suffered disproportionately in the pandemic. And so the Public Health Service, our ask would be for individuals to do whatever they can to try to break the chain of transmission. Sorry for that long-winded answer.
Thank you both very much.
Any questions from AM 800?
Doctor, I guess to that point in regards to the increase in cases we're seeing in our area, so since last Friday, if my numbers are correct here, the health unit has reported 413 cases. Obviously, a lot, like you mentioned, since September, we haven't seen numbers like this. But an increase like this, was this expected, or is this catching you and the team off guard here?
Well, we're always ready, as doctors and public health services, we're always. Pandemic is not over, so we expect variations in the case counts. I would have preferred to see less cases and more cases. I think we all would have preferred to see less cases and more cases. I think the contextual issue is this: the number of cases is one metric of the burden of disease, but another metric of burden of disease is the number of people currently hospitalized and the number of people in the ICU and the number of people dying. The difference at this point in the pandemic is in a vaccinated population, even if you get people the same number of cases, the disease has a less serious course. So if you're a vaccinated person, you're less likely to get infected. But if you do get infected, the disease is more likely to be mild and self-limiting, and you're less likely to be hospitalized. So that's the balancing act. We definitely want to break the chain of transmission, reduce the case counts, but we also want to get people vaccinated so we reduce the burden of disease and the effect on the hospital and other hospital resources. A hidden consequence, or an unrecognized or not well-articulated consequence of people being hospitalized with COVID-19 is that means that those hospital resources can't be used for other medical treatments, and there are people on waiting lists and waiting for other treatments at the hospital. And so to that extent, we weren't caught off guard. We were anticipate that there'll be variation in case counts, but we're also concerned that these additional cases will strain the health system overall.
I guess to the hospital point, just off the stats from yesterday, 21 individuals in hospital with 10 in ICU. So that number's climbing as well. So there's concerns there.
There are. We are concerned that province-wide, that as the case counts go up, will that saturate hospital resources? And the other thing to think about is that many of the hospital staff and healthcare, first of all, doctors and nurses and therapists, this is our job, and we're trained to deal with sick people. So that being said, it's been about 18 months, 19 months of people working sort of extraordinary hours with extraordinary clinical demands. And I am concerned that one of the things is that we have a workforce and a hospital workforce that are tired and exhausted, and a public health workforce that's exhausted. And we have to be also cautious that we don't saturate that resource, that even if we have hospital beds available, we need to have the people to operate those hospital resources and the people to operate the public health service. So that's always a concern. And I think others have articulated this as well, is that, how do we make sure that we have human infrastructure to manage the continuing pandemic as well as other diseases?
Not sure if this question's for tomorrow, but I'll throw it out there right now. Of the cases we've seen since Friday, the 413, any indication if those are individuals that are fully vaccinated, only one dose, or no vaccine whatsoever?
Do you have the data on that, Nicole?
No, we will. Rob, you're right. You're ahead of us as always. We will be reporting that tomorrow. So we'll look at the last 7 days and the mixture of our cases by vaccination status. We are seeing more individuals who are vaccinated, which is again concerning for us. But we'll have that update tomorrow. We'll have that exact number tomorrow. Our Ramsey will be joining us and will provide a thorough update on our last week in our cases.
Thank you.
So, if I can supplement that, the one thing we know is that of the people that are hospitalized and of the people that are dying, the vast majority, the disproportionate number are people who are unvaccinated. In fact, hospitalization is, for the most part, not exclusively, but for the most part, a consequence to the unvaccinated. And we can try to provide you additional data on what that relative risk is, but I think that it's quite a bit of the deaths. The deaths are of the unvaccinated, despite the fact that the unvaccinated are a smaller group of the overall population. So I don't know if that provides some additional insight to you, Rob.
I appreciate it. Thank you very much.
Maybe I can just add one more thing before we leave. Again, we know that parents, we don't want to see dismissals in schools. We're over 600 cohorts that have been dismissed now since the beginning of the school year, and we could probably look just a few weeks back. But we're seeing, a significant number of dismissals of students from school daily, more than we've ever seen as it relates to exposures. So again, I think, our goal, and Dr. Nazathuri has articulated it very well over and over, our goal and our focus is to keep children in school and to help to limit that exposures. That takes the community, and as we said, some of these activities and social gatherings outside of school, that's resulting in a high number of students being dismissed. They're missing days of learning, and that certainly is something that a message that we want to get out there and we are concerned about. We're seeing a significant number of students being dismissed from school due to exposure.
Yeah, and if I could supplement that, 600 cohorts of children at 20 students a cohort is 12,000 young people. So 12,000 young people have been inconvenienced and have been affected by COVID exposures. And those 12,000 young people are doing their part to break the chain of transmission. Those 12,000 young people and their families have had their lives disrupted so that we can prevent the chain of transmission. That chain of transmission goes from them to older members of their family, to elderly people, and to vulnerable people. But the people who are most benefiting from the disruption to children are unvaccinated people in their 50s and 60s. Because people in their 70s and 80s who are living in retirement homes and nursing homes, in Windsor-Essex, we have excellent penetration, vaccine uptake in people in their 70s and 80s. I think people above 80, it's 90, Nicole can correct me, I think it's like well above 95%. So I would appeal to every person who's in their 50s and 60s today who's not vaccinated, who currently can get vaccinated, to think about the real superheroes, which are those little kids who are being inconvenienced in their school to protect people in their 50s and 60s who elect not to get vaccinated. Vaccine isn't perfect, but it's one key method to try to control the burden of disease. And I think it's worth reflecting on the contributions of young people, and also appealing to those people who are currently not vaccinated to reflect on how they can contribute to the community, especially in this time when we have an uptick in the number of cases. And at the Public Health Service, we are reluctant to put in additional public health measures if they're not necessary. So anyway, I wanted to share that with you, and forgive me for being so bold on that.
Okay, thank you, Dr. Nazathuri. I think we're going to end it here, given the time. Want to thank everyone, and we'll see you again tomorrow at 8:30 in the morning. Thank you, everyone.
Thank you.